Well, good morning, Hawaii. It is 10:30 here on March 31st. I'm Ryan Kalei-Suji, joined by Yunji Denise, and this is Spotlight Hawaii. We want to thank so many of you already tuning in this morning and encourage you to continue to share this video and add your comments in today for our special guest, Yunji.
That's right. We have the Director of the Department of Health, Dr. Libby Char, joining us this morning. We know so many of you have questions about vaccines, about the COVID rates, where the virus is right now. So we want to welcome her to join us because she's got a lot of answers for us this morning. Thank you so much for being with us, Doctor. We want to start with some news, if you will. I know that the department has decided to shift more autonomy to the neighbor island district health offices. Can you tell us about that to start?
Good morning. So the Department of Health has been determining the eligibility for vaccine at any given time. And we're trying to walk a fine line between making sure that there's a brisk uptake of appointments that are available and also keeping it at a pace that's reasonable so that people can get appointments and it avoids, that real anxiety and panic. The neighbor islands are in a good place right now. And I think they're better able to designate who should be eligible for vaccine at this point in time. They have different resources, different circumstances and situations. So the change will be that the district health officers in each of the counties will help to coordinate that designation for their island, because I think some of them are in a position now where they can open it up to more populations a bit faster than we can do on Honolulu. And we don't want to hold them back. We want to make sure they're able to get out there so that the vaccines can get into people.
So as a follow-up to that, the neighbor islands will essentially be able to determine their different categories of when people can get vaccinated. How will those on those islands be notified and know when it is their turn? Should they expect something from their local health leaders on each of the islands?
Yeah, I think, again, we're working in partnership with the Healthcare Association, with our hospital partners, with the other healthcare partners on the island, the federally qualified healthcare center. So the district health officer will help to coordinate all of that, and I'm sure they will get word out as to which populations are eligible. Part of the challenge is working with CVS and Longs and the federal retail pharmacy program. I think some of the Safeway stores are coming online now, and whatever we designate is statewide. So it makes it a little challenging. So they're going to try and work with their local pharmacies to see about shifting some of the eligibility there as well, so that it's all consistent across the county.
And will it be age-based, or are you talking also about different professions or different health, if somebody has an underlying pre-existing conditions? How do you see that opening up happening? Because right now it seems like it's just basically happening in 5-year age increments. Do you think it's going to be a little bit different in terms of how it opens up, or will it just keep going down 5 years at a time?
So I think it'll be a mix. Typically we're focusing on two simultaneous groups. So one is to minimize the individual morbidity and mortality, health illness and severity of illness for the individual, and that's the age-based, and that's those that have other health conditions. On the other side, we've always been working with the essential workers to keep those who are interacting with and are at higher risk because of their work, keep them safe as well. So we've always had those two parallel tracks. If you remember in 1A, it was those in long-term care facilities, as well as the frontline essential workers and healthcare workers. And then in 1B, it was kupuna 75 and older. And then it was also the other frontline essential workers. So in 1C, it's 65 and older, those with various chronic health conditions, as well as the other essential workers. So there's always been two parallel tracks in order to catch both sides of that. And so I think it will continue in that vein. I think the neighbor islands have already done a really good job of getting to various age groups as well as getting essential workers.
I want to bring in a question here. Champ is asking, how will we get to choose the vaccine we want to take by provider? Are we at a point now where people who are able to get the vaccine and it is their term, are they able to decide which one they get? And if not, when do you see that happening?
Sure. So the vaccination has always been voluntary, and at the various community pods that we have, it's based on the availability of which vaccines we're receiving from the federal government. So for the most part, many of the hospitals are using Pfizer. Many of the community pods are using Moderna. And as we slowly start getting some Johnson & Johnson, we're trying to get that out there as well. The federal retail pharmacy program is getting a mix of all three of those as well. And I believe when you go to make the appointment, you should be able to see what vaccine is being offered at any given location. And that's absolutely a fair question. So people should be able to select, where they want to get vaccinated and correspondingly what vaccine is being offered there.
Let's talk about the rollout overall. Are you satisfied with the rate in which these shots are getting into arms? When you look at how many vaccines we're receiving, and sort of the surplus that we have, are we getting through those fast enough? Would you like to see that happen faster?
I would definitely like to see things happen faster. I think we're doing a good job, though. I think our rollout has been good. When we get the vaccine, we're doing a good job of getting it into people pretty quickly, within a week or so. And so for the most part, I'm happy with that. I would have liked to have more vaccine at this point in time. We're receiving maybe 60 to 70,000 doses per week. And we just got word that this coming week, we will be receiving up to 80,000 doses. And for the week of April 4th, about 90,000 doses. So we're finally starting to see that uptick. We had been sitting at 60 to 70,000 doses a week since February 28th or something. So we're finally starting to see that go up. And I think part of the trade-off is that our state is receiving vaccine, but a lot of the doses have been going to the federal retail pharmacy program, to CVS, and now I think there's some Safeway stores also involved. And so it's been in the state, but we don't really have a good view of what's going to the pharmacies or which pharmacies were participating or how they were getting added. And so it was a little bit of a challenge just because we couldn't really coordinate with them. But I think we got word the other day that that pharmacy program is getting up to 40,000 doses this week. And so that will help greatly, because if there's that much vaccine out in the retail stores, then it should open up access. I think there are over 50 stores now statewide that have vaccine. And so that should really help to facilitate people being able to go to their neighborhood stores, make it much more accessible to everybody. And so that's part of the reason for opening up and letting the neighbor islands move a little bit quicker, if you will, and at a different pace.
How is the Department of Health planning as we begin to get more of the population that qualify to get the vaccine? How is the department preparing for a larger influx of people that now are eligible to get the vaccine? We're seeing these long lines on the mainland of people waiting in cars for hours. How does the department plan to do something to prevent something like that from happening once we get to that point where many people are now qualified and are able to go and get them?
That is a great question. And that's kind of what we've been doing all along, by trying to specify certain target populations as being eligible rather than just saying, all 500,000 people in one seat, go for it and try and book an appointment. We're really trying to avoid that kind of panic and chaos where people are trying and can't get an appointment. And so we've been doing it in tranches, if you will, so that I think it's reasonable people are able to get an appointment in a reasonable amount of time. And then once we know that we're there, then we add subsequent populations. So we have no plans to change that at this point. We'd like to continue a steady march forward and just add eligibility. Additionally, as we go to younger age groups, that's also going to be affected by a lot of people having gotten the vaccine through, say, their workplace or their job. Say if you're an essential worker. So a lot of the people who are in the, for example, 50 to 60 age range have already been vaccinated, not through the age category, but through work. So just trying to kind of modify those numbers. And that's why we look at a number of factors before we add on eligibility and open things up a little bit more. And that's also why I think it makes sense to allow the neighbor islands to move at a little different pace.
Sorry about that. Let's talk a little bit about where the virus is, the numbers that we're seeing. We were doing very, very well for a while. That allowed us to get into tier 3. But we have seen, not yesterday, but in the previous days, triple digits several days in a row. What are your concerns in terms of, seeing the case counts? And then also when Dr. Green was on here just a few days ago, he said that his particular concern was the 18 to 44 population. What are you seeing just in terms of community spread and where the virus is and that sort of move from tier 2 to tier 3?
Yeah, I think with the move from tier 2 to tier 3 that opened a bunch of things up, we are very concerned. We've seen the numbers go from an average of 40 new cases a day, a couple of weeks ago, to now we're up to, I think today we're up to 99 new cases a day on a 7-day average. So that's been a steady trend upwards. So we're very concerned about that. I think, we obviously still need to be very, very cautious. We still need to wear our masks. We should not be gathering in large social groups. I think by opening things, it's that kind of message is taken by the public, whether it's intended or not, that's taken by them, that it's okay to let our guard down. And we really want to caution against that. If everybody could just please hang in there for another 2 to 3 months, we will have a significant amount of our population vaccinated and we will be that much safer. So please, please, please just hang in there for a little bit longer. We're doing well overall. We don't want to see a spike. We don't want to have to change restrictions.
And in terms of the type of what you're finding out through contact tracing and through those that are testing positive, what seems to be, is there any trends or anything that you've noticed? Age range, as Angie said, that the Lieutenant Governor mentioned, that 18 to 45 age range, or are you noticing any of these clusters, and where are you tracing the virus back to?
So we're seeing the spread. It's wide community spread, especially on a couple of the islands, but it's community spread. The younger age ranges, because I think they're more active, have been higher. Historically, the older population up to 65 was a higher population, but I think with the vaccination, when you look at infections and hospitalizations, that's come down significantly. Of note, though, is that the cases are going up in all categories, all age ranges. We are seeing the cases go up. So we still need to be very, very cautious.
Easter's coming up, as we know, and we do expect to see people going back to church. I know that on Maui, there's a cluster at a church. Can you tell us a little bit more about that, and what are your concerns for this weekend?
Yeah, it's Easter weekend. It's a very significant weekend for a lot of people, and we're just really, really concerned about large gatherings and the spread of disease. So there have been several cases connected to a church group, and what we're concerned about is if we have large in-person gatherings, for church services and whatnot, that's just going to continue the spread. The spread has been, I think, over about a month, and we're reaching a significant number of cases. And so we just really, really need to caution people. Again, if we could just really hang in there for 2 or 3 more months, we will be in so much of a better position than we are now.
We obviously are seeing an influx of tourists that are visiting, and just looking at Waikiki with spring break that happened a few weeks back, and just the amount of tourists that are traveling to the island. Are we seeing any infection or those coming into the state that are bringing COVID-19, and are we seeing any of that spread happening from direct result from the tourism industry?
I think overall, the spread that we're seeing is by and large is community spread. And I think that's what we need to be worried about. I think the other thing with regard to travel is that there are cases from returning residents. It kind of makes sense, right, that the tourists are primarily going to stay to themselves and in certain activities in certain areas. Whereas when we come back from travel, we're mingling with family and friends and whatnot. And so it's a much greater opportunity to spread disease that way. So actually, I think we need to watch both, but especially returning residents, we really need to be diligent. If you come back from travel, the CDC recommends that you kind of keep yourself in quarantine for 7 days and that you get tested again after you return. CDC also notes right now they're not recommending travel unless it's essential.
Yeah, on that point, I think a lot of people, especially as our parents and grandparents start to get vaccinated, there is this urge to see people again, to hug people again, and to have these family gatherings because we have been in this for more than a year. In terms of people who are vaccinated, what is your advice to them right now? Because it's sort of hard to figure out what we're allowed to do and what we're not allowed to do. And I think that once you do have a vaccine, especially, let's say your parents have both doses, you do feel like, okay, it's fine for me to see them. What's your advice to folks in that circumstance?
So the CDC recently amended their guidelines. And so if you're vaccinated and I'm vaccinated, they have deemed it that it would be okay if the two of us were to get together and share a meal or something. You know, if you came to my house and had dinner one night or something like that, and that we were in proximity within the 6 feet without wearing masks if we've both been vaccinated. But again, that's for small gatherings, kind of like an individual household level. Also, if somebody's been vaccinated and the other party has not been vaccinated, but is at low risk for severe COVID, such as grandparents visiting grandkids. The grandkids may not have been vaccinated, but if they're at low risk for severe illness, then that's okay also for them to get together without masks, you know, share a hug. But that's, again, a real, you know, kind of on a one-to-one level, single household. It's not for several households to get together, or just that you've been vaccinated, you get a free pass and you can have a giant party. That's just a bad idea. That's not good from a public health standpoint. And again, the vaccines are not 100%, so it's all based on a risk-benefit ratio. But in general, if two parties have been vaccinated, you know, two couples want to have dinner together at somebody's house, that seems perfectly reasonable, and that's within the CDC guidance now.
There obviously has been talk of a vaccine passport, if you will, for those who will be traveling and will allow for more flexibility within the rules and what they are and aren't allowed. Do you think that that is something that's feasible and something that could be happening anytime soon, and that we could see the implementation of a vaccine passport of some sort?
There's a lot of interest, and I think it would be great if we had some way to verify that people have been vaccinated, and then to allow for a little bit easier travel and some exemptions. I look forward to that at some point. Right now, I think the governor has spoken to our national partners, and you know, we were wondering if there would be some sort of national program for that. That doesn't sound like that's in the works, at least not right now. In talking to my colleagues on the mainland, many of the states are wrestling with the same thing. But I think especially for us, since air travel is really such a requirement in order to visit us, that it's all the more germane. It's being looked at. We are working with a number of avenues to see if we can get something like that in place. Right now, it's a matter of being able to verify that somebody has been vaccinated. So a lot of the states are looking at tying it to some sort of registry. You know, could they pull data that way? And then could there be a central clearinghouse that could access those registries in different states? But it's still being looked at right now. It'd be nice to have something like that.
I'm interested just in your own behavior, you know, what you, as you said, that we should sort of stay in place essentially for another 2 to 3 months. You know, what do you advise people? How should we be living? Do you yourself go out to restaurants? Do you gather with people? Like, how are you living day to day? Has that changed as we have headed to tier 3? I'm sure you work a lot, so but I'm just curious in sort of as you navigate, because we're all sort of navigating this, and sometimes it really does feel like we're flying blind. How do you make those decisions? How do you know what is safe and not safe to engage in right now?
So I think in general, we know how to prevent ourselves from getting COVID, if you will. I mean, the fewer people we come into contact with, absolutely wearing our masks, and keeping proximity and distance from people, even if you've been vaccinated. The vaccine's not 100%. It's very effective and it works really well. But of course, there are going to be people who have been vaccinated and still get COVID. And we've had some cases in Hawaii. We expect it. It's consistent with the efficacy of the vaccines. The vaccines are doing what they're supposed to be doing. Personally, I'm not up for eating out in restaurants yet, only because it's a risk that I don't need to take. I understand for some people that that's a real important thing, and that they are doing it. And we look to the restaurants to try and help put mitigation in place to keep people safe. But personally, I'm not ready to eat out in restaurants yet, with the exception of, you know, maybe 1 or 2 places. But I'll get takeout. I think that's perfectly safe. I'm trying to support our local restaurants. It's nice to have that break and to, you know, get some good food or different food. But large gatherings and stuff, no. I will go visit, you know, one other household that's been vaccinated. I think that's reasonable as well. You know, a couple of people spending an evening with a couple of other people who have been vaccinated. I think that kind of thing is safe.
When we look at the long-term plan for this vaccine rollout and those who maybe have gotten the vaccine in the first wave, how long does that vaccine last for them? And will we be needing to take another dosage of the vaccine down the line? I mean, for some cases, of course, like the flu, we have to take it yearly. Is that something that we're going to have to start planning for again as we continue to get the first group of people, this first wave? There may be that group that got it the first time that may now have to get another dose as we move through this. What is the plan moving forward, and what do you think is going to be the effectiveness of the long-term plan for this vaccine?
So we're keeping an eye on that. I think it's, the vaccine's been out since mid-December, and it's so new that we really don't have that data yet. Again, just watching mutations and variants and whatnot, I would not be surprised if at some point, it ends up being a yearly shot or needing a booster or something like that. I think that's another reason, some people are saying, well, why don't we just open everything up now? Because if you get COVID in, it's not that bad. But I think that's faulty logic, because in order for the virus to mutate, it needs to infect somebody. So everybody that gets infected, it's an opportunity for more mutations. And that virus will select out for resistance to some of the treatments that we have now and the vaccines and whatnot. So that's when you hear that it's kind of a race against time to get as many people vaccinated quickly before we see significant mutations or variants that are going to change the way we have to do things. I think already one of some of the monoclonal antibody treatments are rendered significantly less effective in the US because of some of the variants that we have here. So it's that balance. And I think, again, vaccination is one layer to protect us against COVID. It's obviously a very significant layer, but it's one layer. And we know that masks work. We know that keeping our distance and not gathering works. So I think we need to try and minimize the number of cases we have right now. The other thing is that the more transmission we have, the higher our case rate. When our R naught is very high, the proportion of people that we need to be vaccinated in order to get herd immunity goes up. And so it behooves us to keep our numbers really low right now, get everybody vaccinated, and we will be in so much of a better place.
What's the time frame to getting to that better place? When do we reach that threshold, do you think, where enough of us will be vaccinated? And now the conversation is starting to shift not to, can I get a vaccine, but will you get a vaccine? In other words, people with some hesitancy, we know that we have to get to a certain percentage threshold, and I'm not quite clear on what that is. But when do you think we here in Hawaii will reach that point where we achieve that herd immunity through the vaccine?
I think a lot of it depends on how much vaccine we're receiving. And so if we can get a really brisk supply, and we thought we'd have more than what we're seeing right now, but if we can keep up that really brisk supply, I think in the next several months, we should get a large majority of our population vaccine accessible if they're interested. And then it's really going to be exactly as you mentioned. It's going to be a matter of seeking out those who haven't been vaccinated and really finding out why. And if they just absolutely don't want the vaccine and they have their reasons, then I respect that. But for those who just maybe don't understand or have questions about it, then it's on us to make sure that we're providing the education and answering any of the questions that they have so that they can make a decision as to whether or not they really want to get the vaccine or not. It's education, it's access. Sometimes it's going to be a matter of language access, or helping people who don't have access to computers or whatever the mechanism is for signing up for a vaccine. And so we definitely have teams here at the Department of Health that have been working really hard on that, doing outreach, getting to populations where it may be more challenging, and we will continue to do that.
We know, of course, that the vaccine is just one tool in this kit, as you mentioned. The other, of course, is just wearing a mask. And we are seeing many in the community who may be also easing up on that. Tourists as well. There's a lot of people in Waikiki that are not wearing masks. What is the department's stance in terms of maybe stricter enforcement or changing the current legislation that is in place now from the misdemeanor into more of a citation? Does the department have a stance or opinion on how they can, how the department would help to regulate this mask wearing here in the state?
Yeah, certainly from a public health standpoint, the department is absolutely in favor of people wearing masks and wearing them properly. We don't serve in an enforcement role, and so I will leave that up to the other departments and our colleagues that do that. But from a public health standpoint, absolutely. And it is, I'm hearing, that if you go down to Waikiki right now, it's really crowded. But remember that a lot of it is community spread. It's us. It's not just tourists. So we all need to do our part. We all need to wear our masks. We need to avoid social gatherings, as tempting as they may be, as much as we want to do it. Just for a few more months, it will make a big, big difference.
Looking at that community spread, I'm just interested to know what you would tell people as they sort of wait. I think a lot of folks are just so eager. What kind of behaviors are we doing that do you think that we are going to go back to tier 2 essentially if we continue on the path that we're on right now?
If our numbers continue to march upward, according to the tier system, yes. And from a public health standpoint, I don't think we should view the tier system as anything but an early warning system, and a very reasonable way to deal with the current case counts. I think it was well thought out. I think there's a lot of reason that goes into it. And I think that by adhering to the tier system, I think it will help us to do things rationally. There's a lot of reason and science behind it to do things in a safe manner. Again, if we can keep our numbers down for now, just for another few months, and get more people vaccinated, that will make a huge difference to us going forward. Conversely, if we don't, our numbers spike tremendously, and we're vaccinating people as fast as we can, but the numbers spike really high. That's going to make it a lot harder for us to be able to achieve that, protection of our community.
One of the cries of the community right now is for the lifting of the inter-island quarantine and the testing that is required for any inter-island travel. Would you support that, the lifting of any sort of changes and policies to the Safe Travel program for inter-island travel?
So I think with regard to the inter-island travel, again, I can only speak to the public health side of it, because there are a lot of other factors that go into the whole Safe Travel program. But I think if the numbers in most of the communities are fairly low or at least reasonable, and the disease rate is comparable in various counties, then it makes sense to be able to allow people to travel a little bit more freely back and forth. I think right now there's some concern in a couple of the counties. And so at least for the time being, I think, we're in an okay place, but we need to be very, very cautious. But again, this is the public health standpoint, and there are other points of view that are factored in when making the ultimate decision.
There are a couple of questions here in the comments about some allowances that the DOH has agreed on with the mayor, specifically about weddings. Why did you feel like, given that you're saying that, we don't want people to gather, why did you feel like it was safe enough to open weddings to 100 people? And is this a case of just because you can, does it mean that you should? I'm just interested to know why you signed off on that decision, given what you're telling us today.
So I think that's a great way to put it. Just because you can doesn't mean you should. So just to be clear, again, from the public health standpoint, we don't think it's a good idea to have large gatherings, with people not wearing masks, being in proximity for long periods of time. From a public health standpoint, that's not a good idea. But again, that is the public health point of view. And there are many other factors that go into making an ultimate decision before the governor signs off on something. It's up to the counties, though. This is a county rule, and it's really up to the counties to enforce this and to make sure that it's going well.
As our time wraps up here, we certainly always appreciate you coming on, but do you have any final message right now for our viewers out there? Maybe some who are seeing these numbers, maybe others who are waiting for the vaccine. What is your message here this morning for them?
Thanks. I do have a message. I think the numbers are steadily marching up, and that is of some concern. I don't think it's cause for panic by any means, but it really should be a warning that we still need to be diligent and wear our masks and keep our distance. The biggest thing is that wearing masks and the social distancing and not getting into big social gatherings. We know how to prevent ourselves from getting COVID, and that's by avoiding those social gatherings and wearing our masks. There's a lot of information on our website on hawaiicovid19.com. So I would urge people to go there and take a look for all sorts of things related to COVID. And just please, guys, hang in there just a few more months. Get vaccinated. Please behave for a few more months. It will make a huge difference to us going forward.
Okay, thank you so much for spending so much of your morning with us, Dr. Libby Char from the Department of Health. Mahalo.
Thank you so much.
Thank you.
Well, Ryan, very interesting. And for those of you who joined late, the director did announce right at the top of the show that they are changing the way that they're allowing the neighbor islands essentially to open different tiers. So they are giving the neighbor island health directors a little bit more flexibility when it comes to vaccine distribution. This is essentially because the neighbor islands, they have smaller populations. They're doing a great job of vaccinating their communities, and they could be vaccinating more people. So rather than have it be statewide, they're doing it more county-based. So if you live on Hawaii Island, for instance, you might be able to get a vaccine in a certain category earlier than if you live here on Oahu. So that's a big change from the department that she announced just this morning.
Yeah, so good news for those on the neighbor island who maybe are waiting and are not in that category that maybe Oahu is in. They could essentially be moving up faster, and so more information will be coming out from the Department of Health, as well as when you will be notified when it is your turn. Also interesting to know, she's saying that they are seeing an increase in the number of vaccines that are being made available, and that they are getting more out into the community through the community-based centers, through pharmacies and through CVSs and things like that. So we will be able to see more and more individuals be able to sign up. We are at a point, however, that we are not able to sort of pick which vaccine you want. That preference is not really available unless you are qualified in different areas and you call around. But her advice is really just going to the designated area and taking what you can get at this point.
Right, first available, and the more people that get those shots, the better. It does sound like we're really at a crossroads right now. She's saying just hang tight for a few more months. Our behavior right now could really make the difference for the trajectory of the pandemic here in the island. So, she herself says that she's not quite ready to go to a restaurant just yet. Of course, support your local restaurants. We want to emphasize that. Do take out, support local as much as you can. But she herself saying that, restaurants, it's not quite the time for her comfort level for dining in. And also with the gatherings, we know that Easter's coming up. She mentioned a church on Maui that has a cluster, I believe, of around 50 cases right now. That is over time, over about a month, but still that is a concentration of cases. And since Easter is this weekend, she's saying if you can, please make sure that you're socially distanced if you do decide to go to services, and wear your mask.
Yeah, the overall theme, I think, throughout this last half hour has been to really hang in there. Multiple times she's pleaded almost with the community to just hang on, to avoid these gatherings, to wear your mask. Many of the same messaging that we've heard over the past year. However, I think for many, it's falling upon deaf ears, and the Department of Health is really trying to ensure that people are behaving themselves and really making sure that we continue to take this seriously as we see these numbers continue to climb.
Yeah, and a bit of a warning that if we continue on the trajectory we're on, we could be forced back to tier 2. So that is more incentive, of course, to comply with the restrictions that are out there right now. We're going to be shifting gears a little bit on Friday. We're going to be talking about the arts and some of the changes that are happening. We know that, people who are performers, Hawaii, of course, we love our local musicians. We're hit particularly hard, but there are some measures that are being taken now to allow for some in-person art performances. So we're going to be talking to folks from the Manoa Valley Theater, along with the Hawaii Symphony Orchestra, and some very recognizable faces as well, Ryan.
That's right. Camille Minor will also be sharing about how they, as a musician, she's been able to survive during this time, and how they've also pivoted the industry during this time and come together as a collection of artists to support each other. It'd be great to hear how they've adapted during COVID-19.
So please sure to join us then. As the director said, wear your mask, socially distance, do all the things that you need to do so that we can get through these next few months. And if you are eligible for the vaccine, please do sign up to get one. Thank you so much for joining us this morning. We'll see you right back here at 10:30 on Friday.
We'll see you then. Aloha.